Thank you for watching the Housing Oregon YouTube channel. Be sure to join our network and get involved in the work that we are doing. If you can, please like and subscribe. It helps us build this channel, which serves as a platform to communicate with our members. This video is part of our 2025 annual conference. We're looking for folks to be on the conference planning committee. Please email info@housingoregon.org.
My name is Margaret Vliet. I run a consultancy called Trillium Advisors, and I'm really excited to be here today to talk with you about some cool work happening in Clackamas County. And so I'm going to let my colleagues introduce themselves and set up this fabulous conversation we're going to have. We'll make sure we have time for Q&A. So if you're interested in follow-up or questions occur to you along the way, jot those down and we'll make time for that. So I'm going to start to my left and have Melanie, my friend Melanie from Clackamas County, introduce herself and just a word or three about her engagement in this work.
Thank you so much, Margaret. To piggyback, thank you all for joining us during this discussion. My name is Melanie. I go by Mel Pascual, she, hers. I'm the Quality and Data Supervisor at Clackamas County Housing and Community Division, or Community, CDD. It's on my bottle. Housing and Community Development.
Division?
It's a division. It is also a division. I've been there not long enough to remember the name of the division I work in, but 2.5 years. I've been with Clackamas County for almost 9 years in a similar role, working in healthcare, federally qualified health centers. So it's nice to see some like health share folks, and as housing and healthcare are starting to intertwine and integrate more. So I've partnered on this with my colleagues here as a bird's eye view and a detailed view of our data and how we can problem solve, as we will discuss later.
Hi everyone, I'm Peter Rosenblatt. I am the Senior Program Manager at Northwest Housing Alternatives, or NHA. NHA is primarily a housing development company here in Oregon, but in Clackamas County we also provide social services. And so I oversee an array of social services for homeless families in Clackamas County, which really led to my involvement with this group because around 4 years ago, I got together with a bunch of colleagues that also work with families in Clackamas County, and we had one question. How many homeless families are there in Clackamas County? And we thought, oh, this will take like just a day or two to figure that one out. We were wrong. It took quite a bit of time. But in order to design a system, we needed to know that number. And so with this group, as this group was formed, I was the provider representative. So I was able to speak from the provider perspective with regards to the work that we're going to share with you in a minute.
Thank you. Hi everyone, Kyle Doran with Social Finance. Social Finance is a national nonprofit based in Boston, and we work with states and counties across the country on all things outcomes, so performance management, data systems, and visualization, innovative contracting mechanisms, and the like. I am based in Boston, but these three are tired of me saying I grew up in Portland, go Generals. I work across issue areas, so I'm somewhat of a visitor to the homelessness space, but I think the tie that binds is this focus on outcomes. How are we helping visualize the data we need to make decisions and get to functional zero for family homelessness in Clackamas County.
So before we get started, I want to just kind of do a quick check on who is in the room with us today. So if you are here from the metro area, can I see your hands? Okay, decent representation. Okay, if you're here, I guess probably the rest of you are from elsewhere in Oregon. Anybody not from Oregon in the room? Okay, Kyle, yeah, all right, good, thank you. Anybody representing their continuum of care? Just one, it looks like. Other local government? Okay. How about OHCS? Is OHCS in the house? Awesome. Thank you for being here. Okay. Do we have anybody from the healthcare industry? Awesome. Good. Okay. Any other nonprofits? I feel like not everybody raised their hands. Nonprofits. Oh, that's what it is. All right, gotcha. Okay, good enough. So I had the privilege of helping with this project a little bit, really as a subcontractor to social finance. Because I'm local, I was able to help sort of bridge between the Boston crowd and the local crowd to just understand kind of the local context. And as everybody probably knows in this room, our system has changed quite considerably in the last few years for lots of reasons. Not the least of which is the passage of the Metro Supportive Housing Services levy. So that has put some, I would say, creative disruption into the system, and I think that was part of the landscape that helped bring this project together. So I'm going to start with Melanie as the representative from the county. Melanie, can you talk a little bit about kind of what prompted this project and where was the county at, and sort of from your perspective and memory, how did this all come together?
Yeah. Well, I believe I may have been hired months after the formation of the contract, maybe years, I'm not sure. But I think I was 6 months into my role when I received an email from our then deputy director of our housing H3S, so a larger executive at the county, said, "You're going to get an email from these people at social finance. Give them what they want." And I was like, "Absolutely, that sounds great." I think at that time, so I now have a team of 8 FTE with 1 FTE embedded in our technology services, which is our IT. And when I started, we had, with me included, four people, and one I like to call like the designated Metro. I know my Metro friends are in here, like just working on reporting nonstop. So to me, it was like such a blessing to have this nationally recognized social finance in my previous work. And I spoke with, I think it was Annie at first, one of the VPs at social finance, and kind of she informed me of the scope and the work, which was we want to create a family housing map for the capacity of your system, how much housing inventory do you have versus the need, and what are your actuals right now. So I looked at this as like an extension of the group while we were trying to build capacity at the county. And thanks to that partnership, I was able to say, like, I'm new to this data and the lexicon of housing. Like I said, I was from healthcare. I was pretty much just hired because I know how to count beans. And I was just like, I have no clue why I'm seeing these discrepancies as I'm learning about the database that we're putting data into, the requirements of all that work, the program differences, and I wasn't even in a place to even understand, like, how does that all affect families? How do they fit in there? What's even the definition of a family? So I had a few initial questions that I shared with social finance of, like, here's what we're seeing in our inflow and outflow, which is folks entering the system as our inflow, and then those that are exiting either because they've been permanently housed or for other reasons of resolution and crises. So based on that, I think you all had been cooking for a while. I remember you had met with the community, and I attended a community meeting where you were gathering more needs and problem assessment of the environment. And I was kind of being tapped in and plugged into, like, what does the data say? How clean is it? How bad is it? And maybe further down in the questions, I can explain like a really huge aha we had because of this partnership. And then the amount of lift it took to ascend like a data governance structure to support really reliable data and where we're at now. So it all really started with social finance. Yeah.
Thanks, Mel. I think what I recall as well, to just supplement and build on what you're saying, it just that this, it's not like Clackamas County is alone in struggling with data and pinpointing, like, okay, well, the point in time count says this, and then over here we're using this built for zero and by name list, and wait, okay, how does that work? And then you're trying to explain it to elected officials who are paying a lot of attention these days, because they are. And so getting to the data, I mean, I think people in this room recognize it's not easy. And so it's not as though Clackamas County was somehow out on an island by itself. This is a very common problem from what I've seen over my years. And so the project evolved a little bit and became quite focused on this data question. And so Kyle and his colleagues at Social Finance helped develop a tool. So I'm going to ask you to kind of walk us through the tool. You know, take a few minutes, but then I'm guessing some more conversation and questions will follow after an overview. So.
That sounds good. I am going to kick off with a few slides and then go into the tool itself. I also use acronyms like HMIS and ask that people interrupt in if and when we need to spell those out, and we'll turn to Peter, who's the explainer-in-chief, to explain everything. So this is us. We'll circle back to email addresses at the end if anyone wants to reach out. So basically the goal that we started with was ending family homelessness in Clackamas County, getting to functional zero for family homelessness in Clackamas County, recognizing that SHS brought a unique opportunity to focus on a specific subset of the homeless population, and we can figure out how to address it. We tried to get at what the barriers were to addressing family homelessness in Clackamas County. We saw that we didn't have a reliable estimate for the size of the family homeless population, and thus we needed to put more effort into getting a better estimate. And so that looks like the process that you see here, assessing what data is available, developing the approach, analyzing, and then getting a dashboard together. And each of these steps looks easy on paper. It is very, very difficult in practice. What we tried to do was get three things together. A sense of demand, which is a crude term for how many people might stand to use services. Utilization, which is our understanding based on HMIS and entry-exit reports of who is using the system, or how many people are using what types of services. And then capacity, looking at the actual amount of capacity based on contracts and housing inventory count data. All of that leads to a summary view, which gets to a sense of estimated need. So I'll switch over to the tool itself. An important caveat, you'll see a big red box. I didn't switch over to it. You'll see a big red box on the slide, or on the image that I'm pulling up, that basically says pieces of this data set are still being validated by the county, and so none of the numbers in here should be taken as totally certain. So just don't hold us. Something on the front page of the Oregonian would be not an appropriate use of the numbers on this. Here, so.
How about Willamette Week?
Willamette Week is great. It's fair game. Mercury, that's fine too. So let's see. On the summary slide, there are, I'll just point out, there are 5 tabs down here. 1 summary, 1 demand, 2 for utilization, which I'll explain, and 1 for capacity. Over here, columns for the type of service, and then a sense of the numbers of folks who are in each, or a number of households rather, who are in each of these categories. Let's see. So we'll spend a little bit more time teasing out what unmet demand, what constitutes unmet demand. Annual served is based on HMIS data, entry exit reports. Average capacity, as I mentioned, is based on county contract data. This is directionally right, but as I mentioned, is being validated by the county. And then these 2 analyses on top of, or calculations on top of those data sets. Annual utilization rate is annual served divided by the capacity, so how many people are served, divided by capacity in the contract data. And then estimated need is the difference between that and the sum of unmet demand and annual served. So basically our assumption is the number of people who are not in services but need services, plus the people who are in services, constitutes the whole range of people who might need services. This is a view that's a decision view. We like to say a decision view instead of a data entry view. So directional gives you a sense of what the need is. The idea is that perhaps county officials, people who are looking at how they might reallocate or look at how they might tinker with budgets between services might do so. I'll switch us over to the demand tab, and I'll pause after going through each of these tabs, and we can revisit anything there within each of them. There's a lot to take in here. What we're trying to do here is give a sense or an estimate of how many people might need each type of service that the county funds. And so basically what you see is a baseline number of individual, or of households rather, who need services, broken out by population, SHS populations. And then we, over quite a long period of time, worked together as a working group to develop some logic that began to give us directional estimates for how many people might need shelter, for example, or need permanent supportive housing. And you'll see you can hover over each tool and see what our assumptions are. So permanent supportive housing need, our estimate or our assumption is that there's over a year of experiencing homelessness and coordinated assessment score of greater than or equal to 26, so on the higher side of need. And you'll see we have similar assumptions for each of these. We're happy to go into our assumptions for those, and Peter is happy to go into assumptions for each of those. It involved a lot of back and forth. We also have some filters up here in case the user wants to look at veteran status, any of these other demographic features on the top. That is demand. On the capacity side of things, again, this is a kind of a blending of county contract data as well as housing inventory count data. And what we have is the number of contracted spaces for each of these types of services. So if you hover over prevention, for example, it'll give you the number of loved one spaces for prevention, or emergency shelter, same by provider for each of those services. Shift over to utilization. So we have 2 different views for utilization because we couldn't decide what was going to be most effective or most useful for people implementing services and decision makers at the county. And so this first view is an unduplicated view of what households, how many households are in each type of program combination. So you'll see here permanent supportive housing and supportive housing case management blended together. These are 2 designations in HMIS, and in Q1 of 2024, there was 1 household that was in both of those programs. Same for Q2 of 2025 for ARLA vouchers and supportive housing case management. 61 households were there. So kind of a updated quarterly unduplicated take at how many households rather are in each program type. And it gets complicated quickly, obviously, because people are people. We are not simple creatures. Utilization, so the other view of utilization, we wanted a sense of how people flow through the system. We hoped that there would be some lines in this diagram, and we tried that, and it looked not like a spider web. What did it look like? It looked like
bowl of spaghetti?
Bowl of spaghetti, yeah. Yeah, with sharp angles somehow. It was like some really creative pasta.
Yeah.
So what we have instead is a sense of how many individuals. So this is duplicated, so people can exist in more than one column, it gives a sense of where people, how many families are in each box, each of these situations. For example, a homeless situation or a place not intended for housing, and what their destinations are after that over this time period. And so this is intended to give a kind of a more a deeper sense of if we're fully equipping shelter, how are we thinking about what steps are next after shelter? What's the most typical path? I think there's a lot that could be done here, and it might take some of PSU's brain power to make it more sensible. But I think that it's exciting to kind of see and begin to track where families are making their way through the system. I'll pause there. There's a lot here. There's some filters that can be played with. The whole goal is to make this dynamic for the title of our session, for the county and providers to tinker around with. Yeah, I'll pause there. Any questions, clarifications?
So the dashboard's great, but the collection of the information you're putting into it, what kind of things you're doing to filter that out? Because as a direct service provider, I know that there's a lot of errors within HMIS. So how are your filtration devices before you're looking at the data in the dashboard?
Somebody,
I'm gonna let Melanie.
Melanie,
Yeah.
can you kind of repeat the essence of the question as well?
Yeah, if I'm understanding correctly, is how do we ensure that what we display is cleaned and maybe normalized across the system, accounting for all that can go into data entry. And that's true for housing, and it's true for healthcare, regardless if you make $17 an hour or $300,000 a year. Like, data entry is an abomination and a plague on all of us. So I just want to say that.
Says the woman in charge of data.
Well, I know, right? It's putting my kids through college, that's for sure. But I'll say that, I might be skipping ahead a little bit, but the configuration that social finance has put together based on a lot of the logic that we were talking about, for us at the county, we're looking at this as great, we have the blueprint of how we want to, dashboards are either for discovery for myself as an analyst, inform for you all who are experts doing this, you know what the data means, you know what HMID means, and housing move-in date for those who don't know what that means. But you know what that means and you want to look at that and you want to be actionable, or to educate. How are we telling somebody who's just inquisitive and wants to learn more and doesn't know all of those details? So that was really that's hard work to formalize those decisions prior to creating a tool. And so for the county simultaneous work of the dashboard we've created a data warehouse. And the reason why we made a data warehouse is because of the nature of the reporting that we are sourcing for the dashboard. So I don't know if at this conference we're allowed to say who we use, so I'll just say the HMIS vendor that we uses what's called object-oriented reporting. That relies on refresh and built-in lag with the data, and it's very particular. You have to give it exactly what it needs, and it doesn't let you ask multiple questions. You've got one question, one timeline, maybe more than one program. So we created a data warehouse simultaneously so that we can identify data quality errors quickly, and when we're loading that source data, there is a data quality component before feeding or hydrating the data warehouse. So like, not everybody's gonna be able to do that, right, on the back end and have one of those. So we didn't have that the whole time we've been doing this. And so what that meant for us as a data and quality team is audits, quality assurance. So dashboards, in my view, can be multiple things, but this one in particular is a data quality outcomes. So we want to know how the outcomes are looking. What we had to build simultaneously with this is quality assurance, which is the process, or monitoring the process of the outcome. And so we have weekly audits of assessments, and then immediate follow-up with those teams and immediate support for like, did you mean to put that in there? Do you want us to do it? Is this right? Are they really rapid rehousing? Great. And I think what that took to was normalizing, like, my team's here, we are the workforce behind the workforce, and we are just like, don't shove anything under the rug. We're gonna come to you anyway, and we'll help you with it. Either you can tell us to do it, or we'll do it with you, or you can do it yourself. So we try to give a variety of stuff for good data.
One of the things that providers talked about in the beginning is we already collect a lot of data. Do not ask us to collect any more data. And so we wanted very much to rely on data and data systems that already exist within Clackamas County, and there are many. We have point in time, we have our coordinated housing access or CHA data, we have HMIS, we now have HMIS that's connected to Built for Zero. We have a lot of systems, and they all have flaws, they all do. So, you know, that old adage, we didn't want to let perfection be the enemy of the good, but we wanted to be really good. We wanted to have good data. So that's really what Melanie, from a provider standpoint, that's what I took away from everything Melanie said, is that Melanie and her team are going to take the data that we're already giving, and they're going to do that cleaning up to make sure that it's good. Is it going to be perfect? I don't know, but it's going to be really good.
Thanks, Peter. I'll just add like some context here is that Clackamas County in particular, before the bond, we had $8 million annually for housing. Our wait lists were 20 years long, and then we got $220 million, which is like, when I watch Neil deGrasse Tyson say like, it's 400 billion light years, I'm like, I don't know what that is. I talk like normal. So $220 million was such a huge influx of money. Like, all of these things had to be ascended all at the same time without overwhelming, and I'm sure we did overwhelm the providers, but that's true, and that I think it's really appropriate from my point of view to not try to make really smart people 1% more intelligent by being like, well, actually HUD says that if you're gonna do a round rehousing day, it needs to go in at this time. Let my team do that and just be like, this looks weird. And I'm gonna send you, not a spreadsheet, but a description and an ask. And that's part of a really good, I think, robust two-way team of supporting providers, in my opinion.
One last validation of your point is just that, you know, one of the things that took us longer than we expected to get to something like this was needed to clarify practices on inactive policy or things like that. And
The policies.
right, which is exactly what you're talking about, in the sense that, you know, an $8 million budget has an $8 million commensurately small data department.
Yeah.
And so, you know, when SHS came into being in 2020 and there's this mandate from the public to get services out and just like deliver, and then we all step back and 3 years later we say, oh, wait, we should figure out what's working or at least get a little bit more intentional. then there's this sort of, we observe some friction, we cause some friction that no amount of pizza in the world could fix. Where we tried to clean up some of the discrepancies that we were seeing. But I think we're closer, and the data warehouse is super promising. And I don't know, we're excited about the place we're at, knowing that it's a point in time where this is not totally live yet, and hopefully it'll be used with more use in the future.
And there will be pizza.
And pizza, yeah, sure.
And so from a process, when the providers got together before we reached out to the county, we just looked at how many people are we serving. I can tally that. No, how many households are we serving? I can tally that. And how many households are on my wait list? I can tally that. And you get 5 providers in a room, and you can easily figure that out. Then we were confused when we saw the point in time. We're like, our number and that number doesn't seem to match. And we tried very hard to get these two, like, nope, didn't work. Then in Clackamas County, we're very proud of our CHA, or Coordinated Housing Access data. So we looked at that. Kind of close, but still we couldn't figure it out. They were like, we have 3 very, very different numbers. And then when Built for Zero came into Clackamas County, that number exponentially grew. Prior to Built for Zero, we were thinking like 100 families. Then we're looking at Built for Zero lists, and we had thousands of families. And that, we all had to pull back and go, okay, if we're designing a system for 100 households, that's different than if we're designing a system for 3,000 households. What are we designing? And so that's really where what Kyle and Melanie are talking about. We needed to, as the providers, we needed to both pull back, allow cleanup to occur, and help with that cleanup. And really, and jump in and say, none of us have seen this family for the last 10 years. What are we going to do with it? Let's just not keep them on the list forever and ever. Who do we know? So that really helped get it to numbers that we feel are more actionable. If we're going to develop a system, if we're going to talk about homeless families in Clackamas County, what is the number set we're going to use?
And let me just offer that among the complications are at least when we were actively working this project, it was not seamless when a family moved from Clackamas County and migrated into Multnomah County or Washington County and vice versa. So that was a further complication. Another thing is families can be fluid. Sometimes children are with their parents and sometimes they are not with their parents. And so, so lots and lots of places to just stop and say, what are we doing? How do we want to handle this? Let's make an assumption about how we're going to count this. And then you have to get the providers on board. Everybody has to get trained up. How to enter the data the same way, and then cross-check it. So lots and lots of systems change and sort of deep thinking went into all of this system. I have totally lost where we are. Kyle, what do you want to say next?
Maybe we can talk to some of the trade-offs that we saw, which
Yeah.
we're going.
Yeah, I think, so Peter, are you, can I lean on you a minute to just go a little deeper as the provider? You were always the one in the weekly and bi-weekly meetings who said, okay, I see where you're going, and it works for 80% of the people, but there's this situation you can't forget. So could you talk a little bit about that?
So one of the things that we had to really clarify early on is about language. A lot of times when we are talking about people experiencing homelessness, we are talking about people, but our work is about families. And so we really had to decide, are we talking about people or are we talking about families? I can totally tell you how many families I have in my shelter program tonight, how many families are in our rapid rehousing. I know that stuff off the top of my head. If you want to know people, I need to boot up HMIS and do a people drop because that's what. So, but that was a decision that we had to, and we needed to make sure that all of the providers were on board, and that the county was on board, and that we all knew that are we really focusing on a people count, or since we're doing families, a household count. And households were very, very important, much more important. And then it was really, challenging some of the complexities, some of the dynamics. Life continues while you are experiencing homelessness, and families come together while they are homeless, and families separate while they are homeless. Children live with their families while they are homeless. Some children live elsewhere while the parents are experiencing homelessness and then reunite. I don't have children, but I hear there's this pesky thing of they tend to turn 18 at a certain point. It seems to be really annoying when you're trying to figure out how many children there are, but now you're 18. And what does that mean as you're trying to identify households where there needs to be a head of household? So we really had to sort of stop and figure out, what do we mean by each of these? We were talking about families who move, or they don't even have to move. I mean, there's not like walls between our counties. We have families that we're working with that they'll let us know, oh, I just got called up, I was on a wait list in a Portland program and they called me, so I'm gonna go there. But when you find me an apartment, give me a call and I'll call back. So are they still in Clackamas County? Are they still a Clackamas family? Or are they now a Multnomah family? And we all needed to figure out, how do we classify that family? When does Clackamas County close a family? When do we say, that family is housed? So when are we gonna say, no, we don't have to, as we're designing a system, we don't have to worry about that family. These are the families that we need to worry about. We also have transitional aged youth that are adults, so they could meet who we're working with, but there's a whole other system in place. And so there are transitional aged youth with children, and are we including them in this data set? Domestic violence, for families where there's domestic violence going on, there's a whole different and very private data set. So we really had to spend some time, again, what we as providers thought were just an easy question. How many homeless families are there? And how many are not being served? So how big would the Annie Ross housing shelter need to grow tonight to serve every family who is homeless to get them into shelter? How many ARLA vouchers would we need? How many HUD rapid rehousing slots would we need to make sure everyone gets housed? We really had to have a lot of conversations along that way. And did I agree with all of our decisions? Well, they weren't all my decisions, so no. But I was happy with them. I was happy that we decided. And it was important to just kind of go around the room and say, can we all live with this? Can we be okay that this, for this work here, this is how we're going to count, and this is what we're going to do. One thing that hasn't been said, and I think it's important to say, is we've not gone live with this. So Kyle mentioned that there's still a couple of placeholders in the data, and we hope you'll have us back next year. We'll plug for our next year presentation for chapter 2. And so we've really been working on getting the system, getting the data points, getting the tool, getting the dashboard, and then you're really then putting that into the, okay, now let's use it and let's see what it tells us. And so we think that a lot of things sound great on paper or great in conversations, and they bear out, yep, that was a great decision. And other things, I have a hunch a year from now we're gonna go, oh, we missed the boat on this one altogether. And so come back next year and talk more about that.
Melanie, can you talk about sort of how the county sort of managed this handling of sensitive data and kind of what was involved with making sure social finance had the right kind of access, and as this process was unfolding, kind of
how did others get in on the action? Because I know just management of data and privacy is a big issue, and I'm wondering if you could talk a little bit about that.
I'm like, where to begin? Well, HUD has a, like I said before, I was discovering a lot of the security, not just the nomenclature, but like also the security and handling of HUD collected data in HMIS. And so because the can of worms that kept getting opened constantly, I had some assumptions too. Coming from a HIPAA compliant part of the county, I was just like, yeah, we got this. We can handle this. And moving into HMIS, HUD in general, they have a 2004, what's called the HMIS technology standards that is in the Federal Register. And that hasn't been updated, it's stayed where it's at, and it basically says that you have to follow the same kind of handling as HIPAA. And so what that means is when data is taken out of HMIS and stored locally, natively, whatever, on your own machine, or in a database or data warehouse that's external to HMIS, you have to follow a lot of rules and protocols. So for us, I think social finance was great. We had a simultaneous with focus strategies where their contract didn't say how to extract data. We actually used social finance's contract language to, I felt so bad too. Sorry, this is just an aside, because focus strategies called my division director, was like, who's this Melanie Pascual? Why is she saying that I have to have this thing? And I was just like, what did I say? What did I do? They're like, did you know that this person used to be so-and-so? I'm like, no. So anyway, big social finance for having this language. But basically we used what's called an SFTP, so it's a secure file transfer protocol. And the county has one of these, so we just, promise on lunch to the guy that you constantly bother and ask for this. And that's how we transferred it. So it's an encrypted data sharing thing, which basically says that when the data is being stored separately on your native servers, it's encrypted, and when it's traveling, it's also encrypted the entire time. So when they receive it, it's encrypted. So all that to say, that was one challenge of making sure that that was fine. In social finance, we were fine right out the gate. Other players in the game were people like Focus Strategies, another national consultant agency that was helping us in a similar kind of exploratory discovery session based on our rural households, because the bond money doesn't stretch as far outside of the urban growth boundary. So we have these multiple things that we're trying to deal with. So we were able to fix the contracts for them, for focus strategies, and bring them into the game and have a lot of cross collaboration. The other thing that, why it's not live today is because in the health center, I'm not speaking ill of the county, but my grandma would say is our information technology systems, they'll sell you a nickel for $1, and you have to pay for any help from IT. So we had to secure the contracts to make sure that we could have ongoing IT support. So in order for Peter, who is a contractor with Clackamas County, to fulfill our mission of housing the people, they want to have access to this dashboard that's going to have sensitive information in the background. We triple encrypt it, basically. But in order for Peter and anybody else, they need to have a sign-on into the county to get into that server, to get behind the firewall and see all this information. So that's what we're building now. And the health centers has had that for a long time because they pay for it. And for us, it was just another okay, let's get the contract. How long is that gonna take? We have to get the county commissioners to sign that, and then we'll get rolling. So we're at the phase now where internally, our staff can do this, and we're building the security protocols that HUD says to do, which is, what's the role? What's their role? What's the access? When they look at something, that has to be we have to store that for 6 years at least, of saying like somebody looked at it, this is their name and this is their role. So that's why it's taking time, because there's 200 and almost 80 users now. When I started 2.5 years ago, there were 80 users. So we've exponentially grown, and managing something like that takes FTE as well. It's like, who's this list? How often are we gonna be looking at it? How often do we need to update it? So those are some of the trade-offs. I don't know.
Just some of the trade-offs.
Yeah.
Yeah, go ahead, you've got a question?
So, sorry, I didn't know what
It's fine.
So thanks, Bill. I want to steal everything you've done around data governance.
Oh, you come.
So everybody who contributes has the right to have access to that. Is that what you're saying?
Yes.
So
Yes.
so is the 200 and something users, are those all the coordinated entry or HMIS data contributors?
Yes.
And so being part of your data contributor crew, you then also have the right to get data back. Is that what you're saying?
Yeah, well, the data we get back is directly through HMIS. So it's all in HMIS. However, since you're, flirting with more information, is that our warehouse looks like a website. It looks like you're at a Clackamas County website. So it's got, the Amazon warehouse behind it with all of our stuff in it, but there's a storefront of like, hi, you can come in here. One of the biggest obstacles we have with our service providers is that, and they have with us, is that, we're trying to show quickly in HMIS where people are at physically, locally, like where's their location, and then also in their journey towards housing. And so some of that is like, oh, I sent an email to the housing authority with that paperwork, and where is it? And the housing authority will say, well, we couldn't access that because the encryption the service that organization uses, we can't actually use it. So one of the problems that we're trying to solve is that you could give us data, you could upload it, and we would be notified, like, oh, Peter just sent us a release or a birth certificate or something like that. And we can kind of see how information is traveling as well. So yes, it's a bi-directional communication, but it's also about the role. What is your role? So I know that, Kyle and social finance, there's a public facing part of this too. And that's one of the trade-offs that we'll have to define as well. It's like, how do we want it to show up on our website? And is it something where we assume that both people who know the lexicon will go in and change things, or like filters? Do we want them to do that, or do we just want to educate them and show them what's happening? So those are decisions that haven't been made yet, but we have all of the infrastructure, I think, to help us get there.
So I want to pivot for a minute, and then, so hold your questions, write them down, because we don't want to miss them. So social finance works really all over the country. And my memory is, y'all built this apparatus specifically for Clackamas, but I'm imagining as you did so, you were thinking about its applicability in other communities. So can we just step back a little bit from Clackamas and think about, I want to hear from you, where does this go next, and do you imagine taking it on the road?
And this is a good segue from what you were just saying, Mel. In terms of, what comes to mind is a project we have in Austin where there's a public scorecard for service providers that says, thank you, that for service providers that says basically this is how, how you're performing against different metrics that the city has identified as priority metrics. And that comes with obvious trade-offs. There's transparency embedded within that, but then there's also, a cynic might look at it and say, oh, this provider is underperforming, rather than this provider, like, maybe we need to have a conversation to better understand what's happening. And so I think that that tension is core in a tool like this. to answer your question more directly, I think there is opportunity in here. So this is focused on family homelessness. There's youth homelessness, there's single homelessness, there's the DV population within Clackamas County itself. As Peter was saying, you know, people don't stop at, what is it, Southeast Plaza Street is the division between Multnomah and Clackamas. People don't stop at that street and say, hey, I'm not crossing the border. And so to get a better regional understanding, you could see an application there. And our hope is that, you know, Mel and the county own the tool now. So our hope is that you all would be able to, you know, extend it to other folks and who are interested, or at least share learnings. And you all have the capacity to build it, and I know you're adapting it to Power BI instead of Tableau, and you know, like little pieces like that. But like we're all on the same team, and hopefully this can be used. Like the hard-won pieces of this, we're hoping can be used more widely.
So I'm gonna get up and, because I see a lot of appetite for questions, and I think we'll be better served if the questioners ask the question into the microphone. You all have to share. I'll start with you. You weren't the first, but you were the last, so.
This was more in line with what you just discussed about putting this tool elsewhere. So I work in Washington County. We use a scorecard system, like you said, and I'm wondering what that scorecard system, what's the difference between a scorecard system that we are using now to this, I guess, is what I'm wondering. If there is a difference, and if there, and more or less, is this more or less just like putting out there, like, this is what the need is?
Yes.
Yeah?
Exactly. Yeah.
Okay.
So I'd say, you know, the next steps that Mel and team have discussed already is, you know, what does a performance management system, a transparent performance management system look like that everyone has access to, or at least maybe it's anonymized, maybe it's you can see averages across providers or whatever it ends up being, but that would be a complement to this. It wouldn't be embedded within this. You can see a provider view at the capacity level, which is just, you know, we contractually are able to provide this number of spaces in this service that we're providing, but not much at the performance level beyond utilization, which is at this point not accurate.
Got it. Thank you.
Yeah.
So I understand that it's built intentionally for providers, so it's gonna have PPI, but is any of it gonna be public? Basic? Yeah.
Yes. That's still one of the decision points of like, how do we make this public? What kind of digestion, how do we want people to digest it and look at it? Because some of it is very action oriented for like, just from like a decision tree. It's like, do we want somebody to do something when they look at this? Yes or no? And like for us, it's like, yes, we do want somebody to do something. And the next question would be like, do they do that automatically? Do they know what to do? And for the providers, the answer is yes. And like also, where is the venue and forum for that, where we're making those actions happen? When do they do it alone? When do they do it collectively with us? When do we come together? When do we not? And so for the public, it's like, if we're just trying to inform them, then there will be some decision points about like, what are we sharing? It is all on the back end, all of the data, there's what we have is called the DWID, which is the data warehouse ID. So HMIS, for those of you, certain vendors, their unique ID uses PII. So it'll be like MP, my birth date, and parts of my social security number. And so if you're close to functional zero, it's like, oh, I know what that stands for. That's that one guy over there named Melanie. So yeah, there's decision points to be made about who is the audience for this. Because if we overshare, Peter knows what happens.
But It was a key point that took a lot of conversation. Are we creating this for only providers, because we have a certain view of what we want to look at? Are we creating this for more, county administrators? They have a certain way. And even in my own, agency, is it being created for me? I'm doing more macro level work, or for Lisa, who does intakes? She's doing more micro level. And we really, what I kept saying, to the team is, this started because a bunch of provider leaders wanted to develop a system. And we need to know how many of each service do we need in that system. So there may be other benefits and other uses, and so maybe Lisa will end up using it one day, but we want to be able to know how many of each of our services are going to be are needed right now to help end family homelessness in Clackamas County. I also sit on the Metro Regional Oversight Committee for SHS, and each county comes in and they talk about their successes. So county will say, oh, in the last quarter or the last year, we added 100 rapid rehousing slots. And everyone applauds except me, because I'm the annoying one who said, how many rapid rehousing slots do you need? If you need 2,000, I'm not applauding that you created 100. If you need 110, wow, 100 is really good. I'm glad you almost got there. But if we don't know what the system is supposed to hold, what are we trying to achieve, then it just feels like we're, to use another spaghetti analogy, we're just throwing spaghetti at the wall. So we want to be very intentional with our programmatic growth as we design a system.
I'll add one little thing to that.
We gotta move on.
Okay,
We have other
okay.
lines of questioning. I
Okay,
think.
yeah, no, that's
Okay.
fine.
Did you have a follow-up?
Yeah, I'm not familiar with HMIS directly. I was curious to know how frequently the data is updated.
Yeah, homeless management information system, for the vendor that we use, there are 2 updates every day. So what's happening today, we won't know till fully tomorrow what's happening in there. So we're making investments in a new HMIS, a different vendor, where it's much more dynamic and closer to real time. And their reporting system is completely different than the one that we're used to now. That's all I was gonna add.
All good. And I think what I'll just observe about the users here, and I think you're next. Having worked for a lot of different elected officials in a lot of different environments, I can say with some confidence and all due respect, I wouldn't want a city council member or a county commissioner or a county supervisor, if you're in California, to like muck around with this. I mean, you don't want, yes, transparency, and it's not a tool for policymakers, right? It's a tool for practitioners, and so yes, there can be a complementary tool for policymakers, but it's not going to be this. So.
Kind of 2-part question. How was the funding allocated for this out of that 8 million, I believe you said?
Oh, yeah.
Yeah, and then the second part is like estimated cost to this whole platform.
Well, I know that the contract that we had, I'm allowed to share this, right? I mean, I guess I'm looking at you guys.
Public information.
I've got the Clackamas shirt on, so I guess I'm the boss. That's okay. Our contract was $1 million, I believe, over 4 years, is that right? Okay. And so Kyle and I were talking about this as a group, where we're like, I'm not sure how they had a large package of work that they were doing for us, recommendations, system coordination, things like that. So I'm not sure how much. Did you do a calculation?
Yeah, yeah, and it's up to $1 million. We've spent maybe half of it, but it was hard to tease apart, and I think to give the long answer and then the short answer. Long answer is the infrastructure, the process of putting it together was much more time intensive than we expected, which leads obviously to cost. And so there's the human cost of it, of getting practitioners in a room, deciding on what the inactive policy is, cleaning up the data one row by one row, one HMIS ID by one HMIS ID. And then there's the technical infrastructure side of it. I think the technical infrastructure side of it, from the social finance end, we're an expensive nonprofit, but we are a nonprofit, we're not Deloitte. It would be like 50, 60,000, and then the human side of it on top of that, and another 100,000 if you assume it's like a year of services or something like that. That's not expensive, or not cheap. Like I recognize, like this is system level, non-direct services, and so there are obvious trade-offs to deciding to invest in this as opposed to deciding to invest in more rapid rehousing or whatever the actual services are. So we recognize that, and hopefully, the sum total of what we've done here will make everything else more effective. But that's something that the jury's still out for.
Did you design the house?
I think what I would say is if you're a jurisdiction that is looking at doing this work, take a look at how clean or messy your data is right now. And we really needed to lean in to social finance to help clean the data. And it was thousands of households, line by line by line by line. That's what we needed. If you have cleaner data that you feel confident with, or are willing to do that on your own without bringing in social finance, to do that work, then that was a factor of cost. I mean, and we greatly benefited from from their wisdom in helping us go through that. It was messy.
I think it will pay dividends, and I think
Yes.
the learnings are very transferable to other communities, certainly in the metro area and throughout the state. But yeah, it was a big deal, and I don't even know what the pizza budget was. Was it root beer, or did you bring in a keg to go with it? Other questions for these folks? Over here.
Hi, so I'm actually a housing authority, and so the challenges that you can imagine when a lot of our referrals into us come from coordinated entry, the HMIS data system, and how, did you see with this process that cleaner data expedited the ability to get people into their appropriate level of housing? Because we're really struggling with the data coming over to us. Some doesn't have addresses, some doesn't have phone numbers, we don't know how to find the individuals. It's just been a true challenge to keep that cycle going instead of having vacancies and things sitting. So we've really been, I hear you say that CHA, is that a different job? Is that different than the typical coordinated entry system that?
It's coordinated entry.
But is it like one you design, the team designed to fit
Yes.
your community?
Yeah, the county created, I think, 2017,
Yeah.
something around there. Yeah, sorry, finish your question.
No, I guess my question is just this whole, I mean, as a developer, we develop in our own community, and so this information is valuable for me to go, I'm not doing, any more PSH, or this level,
Yeah.
I need to get to an affordable level, or workforce level, or whatever the different levels. This is amazing, but I'm also curious because the data we receive is unbelievable. I mean, it slows
Yeah.
the process completely down.
Yeah.
Yeah, so, and what county are you from?
Very cool. Well, I'm part of that. I'm sure they've probably been trying to reach out. We've heard all about Clackamas.
Yeah.
Oh.
So I will say that Clackamas County's, as a provider, and having to use some type of coordinated entry, not only in different counties and jobs I've had in Oregon, but around the country as well, talk to Clackamas County. What they have done with CHA is absolutely amazing. They both have limited what the data is they need to collect. There's a lot of data that we collect at intake that CHA doesn't need to know. to send me a referral. So they really spent time really focusing on that. And I think the biggest benefit of Clackamas's coordinated access is, unlike 211, which you can call for 1,000 reasons, if you're calling CHA, it's for one reason and one reason only, and everyone who is answering the CHA line, it knows the entire Clackamas County system, literally by name. And so it's not just, oh, well, let me look up something on a spreadsheet and maybe call. So if you want to revamp your coordinated access, your coordinated entry, get a hold of CHA. It's fabulous.
Thank you for the advertisement, paid advertisement. Just to address what you're saying, you know, coordinated entry, coordinated housing access used to be in a different division. It was in our social services division, and now it's moved over into the same division as me, HCBD. But I used to describe that as a data quality person. It's like I'm driving a car and the front differential is CHA and the rear is the housing authority, and instead of wheels I have balloons. And at any given time they're like full of helium or totally dead. So it was really hard to steer that data direction and the governance. So I will say, like, some of the challenges that, like, the thing that I'm trying to get traction on, and like to speak to Peter's, like, the perfection is the opposite of good. For me, I'm like, I just want traction. Like, I just want wheels made out of like rubber and not balloon. Well, they're both rubber, but I just want wheels and not balloons. And so for me, it's the argument of like, there are going to be limitations no matter what. When we talk about, like, should a commissioner see this? And they're like, why is the demand not catching up? It's like, well, some of our emergency shelter are actually vouchers and not a location. And we don't get to know if that was occupied until after the fact, and we don't know how late that exit is by expectation. So if the people working at that shelter, or person that was working with the voucher, didn't say like, oh, yep, this morning they're out at 11, I'm doing the house and moving date today. That didn't happen right away. It's gonna look laggy no matter what. And that's just something that a system is going to have to know how to steward and say easily and quickly, so that people feel really informed about a system that's extremely complicated. So my point is, I guess, is that one of the hardest things, and I said this to these guys the other day, is like trying to get executive leadership on board with a data stewardship or data strategy, from your governance structure, from training to who's in it, you know, nose to tail. And I think having something like this of like, there's a lag. Where is the lag? This helps identify it. It's like, we've got great coordinated entry data, but it's the housing providers using the housing authority that's late, or the coordinated entry system's lagging and the housing authorities move these folks in. What the heck? So I think it's just, it helps identify a leak when you have really good plumbing, which is like your data governance structure. All of this is going to bring to light where the leak is, in my opinion, but you're not alone. Still got balloons.
So we only have a few minutes left. Are there any final questions, or are you anxious to go to the bar? Which I don't think opens for a while.
Yeah. Here we go. The system map.
Can you make it any bigger by any chance?
Yeah. This is a limitation of Tableau. But
So
I'm happy to.
it's not a linear continuum from left to right? Or is it?
Lightly. The question was, it's not a linear continuum from left to right. I think, like, I guess, yes, and also circular, and also intersecting.
Fair enough.
Yeah.
So coordinated entry, that's someone who is only in the system as a data point in coordinated entry. So if you only exist as a data point in coordinated entry, you're not accessing the shelter, you're not accessing PSH, you're still on the map, right?
Yeah, exactly. You're still on the map. This is called a tip tab, or in any case, tooltip. Thank you. The tooltip is showing where households are going after their coordinated entry designation.
Okay, cool. So you can see at risk, coordinated entry, it's not just people who are dwelling or not in the housing term. They're not just there in that status. It shows where they would go to your spaghetti thing earlier.
Right.
Okay, so I was just curious how y'all handled people who are only in coordinated entry. They're on the board.
They're on the board.
Even
As
though
long as
really-
they're active. That's where
They're
the
not,
inactive.
they're not receiving a service perhaps, but they have been assessed.
Yeah.
So the mere act of being assessed gets you on the board.
That's right, yep.
In fact, it was easier and rare when a household was just in one box. When this household is just doing this, but they're doing this, so you like, I keep mentioning shelter, I operate a shelter, but everyone in my shelter is also working on housing navigation, and we're gonna be providing financial, so that was a conversation, how many times do we wanna put the Smith family on here? How many boxes do they need to be in? And if we know they're gonna go to that box, but they're not there yet, how do we do? So these are the questions that again, we created that tension, really good tension, the tension that we needed to figure out.
And sorry to keep talking, but is that what's called object-based design? Like you're saying, is that what that means? Whenever you do it to disambiguize this problem?
I don't think so. The object is like, it's like your field. I don't wanna like go into a deep nerd tunnel, but like, it's, you know when you're in a website and there's a field, right? And you've entered something, that's like a field level choice. The back end of that is a semantic model, which the bigger nerds than me are like, let's get at human terms on how to describe it. The semantic model is where the objects come in. The name of that is the semantic design of your favorite thing, a database. Yeah, and so how does that stay hydrated and live? Sometimes there's lag inherent because there's only so many things that HUD says is like, you have to record, you have to gather, and there's a lot of daylight in between an entry date and then like, where are they, what's going on with them?
But are you implying that there are bigger nerds than you?
There are. I don't get invited to a lot of stuff because my lack of nerdom.
So we will stay here. Kyle will keep the screen on, so if anybody wants to look at it a little closer. Thanks for being here, and enjoy the rest of the conference.
Very thorough documentation. Like, what's the source of the data? Where is it located? Thanks for